Today we're going to be talking about United Healthcare and their short-term medical plan. Now, the reason why I want to talk to you guys about this today is because there are a wide variety of different plans, what they do and how they work. So what we want to do today is go to the website, uh, is where we want to go. And we're going to start with the zip code. Now, this video is only for quoting purposes. You should not be signing up anybody directly on the UH1 website. This is only for quoting purposes. Again, it's really important that when you submit an application, you submit it through your portal so you can get accredited for that sale. Now that we're looking at UHC, STM, STM is short-term medical. In the quoting process, they're going to ask you for a zip code. I want you to know that prices only change by county. All right, so that's really important. If you have different individuals living in different counties, most likely they will have different pricing points. So let's go ahead and start the quoting process. Tobacco use. You do not want to press this button right here, because right here is where you're going to let the system know that you also want to get quoted for ACA. Now, we do ACA products as well, but you should not click on this because it will give you very abrupt information that will most definitely mess up your quoting process. Right now, what we're going to quote is strictly United Healthcare short-term medical. Now, a lot of people ask, what is short-term medical? Why do those plans even exist? Well, short-term medical, the reason for them is because there were a lot of individuals that used to fall into periods of gaps in coverage. And there wasn't any solution for that other than waiting for the next open enrollment period. So what we have here is different options for short-term medical. This will cover emergencies, it'll cover some preventive care, and it'll also cover urgent care visits. Some plans do also cover drug prescriptions. Now, I must be transparent and let you know that these plans do not cover pre-existing conditions. Most short-term medicals, if not all, do not cover pre-existing conditions. What we want to do when we go onto the quoting software and the quoting site, what we want to do is filter the options by deductible. Me in particular, I like doing this because I want to give my client the best options. Now, here are the options, here are the prices, and what we'll see here and what you want to avoid is certain plan options that are not in your benefit as an agent because you will not be getting paid. So it is crucial that you do not submit any direct applications. If you see the name of the plan and it happens to say direct within the plan, you should not submit that application because it will be submitted as if the client was applying directly on United Healthcare. So you want to avoid those type of plans, especially when they have the word direct in the name. Now, these co-pay plans are usually the best. When I say the best is because, they make the client feel as if they actually do have major medical coverage. Although I must be fully transparent, you cannot say that these plan options or these medical plans are major medical. You cannot say that legally, as these plans were strictly made to fill the gaps in coverage that many individuals were having. So if you click here, we go through the brochure, and in the brochure, you'll get a little bit more details. All the brochures are exactly the same. You'll be able to see all the plans on this one brochure. You see short-term medical and the states that there are available in. Now, these coverages do go up to $2 million in complete coverages. We'll review the coverages and how they work in a few minutes. Right here, you'll see that there's a copay plan, the Premier Elite, the Plus Elite, Plus Value, and the Value Direct. The Value Direct, again, is something that you want to avoid because those plans are priced not including the agent. Very important. Those plans are priced where the agent commission is not calculated. So if you do sell one of those plans, telling you up front, you will not be getting paid for that. So that is not the plan that you want to offer. You always want to offer the best options. Now, in particular, in these plans, or the availability of these plans, we will see that the maximum benefit is $2 million. Now, these deductibles are per person. And the beautiful part about UHC is that they have a two-person maximum. And that's beautiful because if you have a family of six, like mine, um, if you happen to have one of these plans, God forbid, you have an emergency, everyone goes to the hospital, you only have to meet the deductible for two people. And then you start going into your maximum out of pocket and co-insurance costs. So we see here that the maximum co-insurance, maximum out of pocket, I apologize, is $5,000. Once those $5,000 are reached, the insurance will cover 100% of the medical bills. All right, so now we go on to medical costs and copays. So we see here that the reason why we always want to recommend the copay plan is simply because it does have a copay assigned to that visit automatically. You do not have to be guessing how much you're going to be paying that doctor if you go see that doctor. You already know from the beginning exactly how much it is you need to pay for that copay. So that's one of the things that I like in comparison to all the other plans. Although that does come at a cost, you will see that the plans that have copay options are a little bit more expensive, but that's simply because they do have that additional benefit of having that copay option in case you do need to go see a primary doctor, specialist, or any urgent care in reality. Now, if you need any prescriptions, there's a $25 copay, no deductible applies. If it's tier 1 medication. Now, if it's tier 2 and above, tier 2 and above means brand mark or better, um, there will be a 20% after deductible. Now, I must mention that these plans also do have optional benefits. Now, these optional benefits, you can do them through UHC, or you can offer a supplemental separately. But honestly speaking, if you have the ability to offer supplemental through the plan, you can go ahead and have the plan automatically pay benefits in case of an accident. For example, if you have a $5,000 supplemental benefit, if by any accident the whole family went to the hospital because of the accident, because of a car accident, that $5,000 will help cover for that deductible. And since that deductible was only $2,500 and the maximum was two people, but there's six people on the plan, it's going to be 5,000 times six. So that family is getting $30,000 back, and all they had to pay up front was the $2,000, 2,500, I'm sorry, for each individual that got hospitalized because of that deductible. And strictly because it's United Healthcare, they have a two-person maximum on that deductible. So that's pretty awesome. And the family will stay with $25,000 in their pocket to help cover additional costs, expenses, etc. Now, this does include the UHC national network. You will be able to click on the links once you start the actual quoting process. So let's go ahead and click here, go to more details. Once we go here, we can click this little link right here, open it. Once we do, be able to search the providers, what providers are in the network, what providers are out of the network. It all depends where you live. But UHC does have a national PPO, so that is a great benefit there. Now, the beautiful part about this is because since this plan is the elite plan, normally once that deductible is met, those $2,500, once that deductible is met, your insurance will cover 100% after those $2,500. And since the maximum out of pocket is $0, there's nothing additional that needs to come out of your pocket in order to continue with the coverage. Now, something that I must mention is before giving prices to the client, you must make sure that the plan has already been designed to how the client needs the coverage to be met. For example, if we go to a 12-month option, which would be 364 days, is still not 1 year, but it is 12 months. If we go to a 364-day option, we click on the 12 months, we'll see here that the premium increased. And the reason why the premium increased is because um, the coverage now has to go almost a whole year. And because of that, um, it'll cover pre-existing conditions. And since it covers those pre-existing conditions within that time frame, that's why the plan has to increase the cost, because the plan, United Healthcare, knows that it's more likely that within that year you're going to use the insurance. Now, let's say you select a 6-month plan, and after the 6 month, a week later, the plan expired. A week later, this individual has a heart attack. This heart attack, if the coverage is not active, is now considered a pre-existing condition, and the insurance won't cover that. So that's why it's always beneficial to make sure to have the longest time frame available, so as long as the client is okay with that, or if that's the client's price point, or if maybe that's the option in particular that they were looking for. So it's crucial that we know how these plans work, that we know exactly what we're offering and how to apply for these coverages. Now, the only other thing that I must mention when applying for these coverages, you must always ask your client for height and weight, as United Healthcare does take that into consideration. And I must let you know that based on height and weight, they can also make that declination. I must also let you know that based on that height and weight, they can make underwriting decisions on whether to approve or decline that individual prospect. So we just quickly reviewed one of the elite plans. This is one of the best plans that United does have to offer, because after those $2,500, the client does not pay not one single penny more. So it's a very good plan. Let's go ahead and compare it to another option. For example, this copay option. Let's go ahead and click on the details. We see here that the monthly premium is a little bit more for the 6-month option. If we go ahead and select a 12-month option, we see that that price does go up a bit. Now, this is flexible. We can go ahead and reduce the deductible or increase the deductible. We can increase it all the way to $10,000, and that will definitely bring down the premium. But if you do have an accident, or if you do have a hospitalization, the first $10,000 are responsibility of the insured. So normally what we recommend is always to select the least deductible possible, as long as the client is aware and as long as the client knows that this is in their best benefit. And if they feel that a higher deductible is in their best benefit, that's totally fine too. We've had clients tell us that they prefer a high deductible simply because of the price point. And that all does depend on different individuals. It just comes down to what is their priority and what are their concerns. So on here, we'll be able to select the start date. And once we select that start date, there will be an end date. So for example, if we want the start date to be the 1st of October, we'll see here that for a 12-month period, 364 days, this is very important, 364 days for the plan to follow the parameters that it does. It must be less than 1 year. 364 days is less than a year. So that's why 364 days later, next year, September 30th, this plan ends. And we see here that there is a copay for doctor visits. Now, there is a 20% co-insurance. This is very important. A 20% co-insurance after deductible. So, all right, you have the $2,500. You paid those $50 for your primary doctor. Now, if that primary doctor says that there needs to be additional testing and screening done, you will most likely need have to cover those costs up to the deductible. Now, after that, after you meet that deductible, then you'll go ahead and start contributing to your max amount of pocket. So first, the 2,500 have to be met. After those 2,500 are met, then the short-term medical activates 80/20 insurance. United Healthcare covers 80%. You cover the other 20. Now, once that 20% adds up to $5,000, then is when the insurance will activate to 100%, and you won't need to pay not one penny for the rest of the life of the policy. Now, I must say that once this policy comes to its termination date, a new policy will need to take effect. And with this new policy in place, it is a new policy. So if you had any hospitalizations or you had any medical problems within that first coverage, or if you had any hospitalization within that first period or within that first policy period, I'm sorry, you most likely will not qualify for a renewal simply because of that pre-existing condition. I really hope I didn't lose any of you in that explaining and the verbiage of the explaining the plan. But if you do have any questions, it's crucial that you communicate with your team leader or one of our staff members, because it's important that you understand how these short-term medical plans work. If you have any questions, feel free to contact us.